Hello, everybody. Welcome back to the Incubator Podcast live at the CHNC Symposium in Denver, Colorado. We have the pleasure of being joined by Monica Jones. Monica, thank you for dropping by and being willing to be on the podcast. You have a super cool title. You're a senior family consultant at the Children's Hospital of Philadelphia. And we're going to talk to you are also a NICU parent. And I feel like it's kind of like being the president. Like if you've had a baby in the NICU, you're not like a former NICU. You are a NICU parent. Like it's a title you carry with you, just like being a coach. And you deserve that
ongoing
that credential ongoing. But you're here at the CHNC and doing a lot of good work talking about and discussing how we can address health disparities in the NICU. So can you tell us a little bit about what are you focusing on at the CHNC and what should people know about the work that is being done?
So the work that's being done is, I feel like it's groundbreaking and it's incredible work. I've been a part of the CHNC addressing health disparities for maybe about 4 years. And monthly we talk about how we can improve the care and services for the families that are in the NICU. And as a parent, they get to pick my brain about some of the things that I've experienced and some of the things that didn't go well and how we can improve it. And so we talk a lot about the mental health status of the caregivers, what are the resources that families need while they're in the NICU, and most importantly, when they are preparing to go home. So today, we have an opportunity. Our presentation is today. We're going to share all of the things that we've been working on in the tool that we've developed for like universal NICU across the world to help improve the care and services. And we also have 2 parents that will be joining me on the panel from Colorado Children's to share how they experienced this remarkable tool and what it meant to their family. Yep. So
can you tell us a little bit about one of the things that to me is very frustrating is that we tend to think about the topics you just described and tend to think we have to find a solution. Right. But we fail to sometimes understand that every family has a very different set of circumstances. And I think that we tend to miss the opportunity to make that solution very adaptable to the various needs of the families, because some families have very dramatic difference in their social situations, and the help has to be modulated based on that. Can you tell us about how you're addressing that?
Yeah, so that was one of the biggest things that I raised in our monthly meetings is that every family is different, every socioeconomic status is different, and we miss a lot of parents because we just assume that they have everything that they need. So when they might look at my Epic profile and see that my husband's a soldier, he has a job, I had a job, we have insurance, we have what we need. That was the furthest thing from the truth.
That's right.
So we want to make sure that this tool can reach every family, every socioeconomic status, every race, every culture. So we ask the questions. And then the second thing that I raised is, okay, after we ask the families all of these questions, how do we ensure that they actually get the resources? So the tool taps into each community of who provides what, be it housing, medical equipment, utilities, food, food banks, whatever.
I just like that so much. Yeah. Because I mean, so many. With the podcast, that's what we've been doing. So many people take on projects, and like you said, does it actually happen? And then to me, that's always the metric of whether you're being successful at whatever you're doing. Is that, are you actually doing it, or is the idea just dying off in the desert, the land of all these ideas that you've had in the past? So, one more question for you is, what can you share about the initial steps of you taking on this role and engaging with quite an esteemed group of physicians, scientists? I know myself that every time I have to engage with people that are outside of medicine, I feel very intimidated because I'm like, oh my God, like I don't know very much about all these things. As a parent, coming in with your experiences, how was that initial role and how was that initial experience of engaging with a community of experts and professionals and really seeing that you have an important voice that needs to be heard in that discussion?
So I think the feeling is mutual. Stepping out as a parent to speak to all of the scientists and the people who know how to care for people, it's kind of intimidating, and it takes time to build your confidence to know that I am important. I have a valuable voice, and to know that when you guys are caring for the patients and families, that if you don't hear from me, you may not be giving my child the best care, and you may also be putting them at risk for a medical error.
Wow.
So once the parent learns how important they are, I say a lot of prayers to help me be confident and to ask the challenging questions to help, push the meter on all of the things that the patients and families need. And then I just go with the flow. And it usually just really connects like a well-oiled machine.
Yeah.
Very good.
I just want to say the biggest step is answering the call. After parents and caregivers go through the challenging times of being a NICU parent, some of us are charged with like a higher calling on our lives. And to answer that call was a big sacrifice. So once I did that, it was let's make sure that we can do the best that we can for all of our patients and families, and make sure that we really put effort to listen to those families when they're speaking.
Yeah, to your point, there are so many families that after this experience, really dedicate their lives to improving the future of our care. I think in particular, this concept of social determinants of health, people are buying into it finally. Great, that's great. We're talking about universal screening. But how important you have such a wealth of expertise, I think, being a NICU parent and in your role as a family consultant. How important is it at the local level to be including families as part of this screening pathway?
So as we develop this screening pathway, we include the voices of our families from our family advisory councils. So I'm the chair of the System Family Advisory Council at CHOP, and we bring the social determinant of health topics, and all of our diversity and inclusion, all of our privacy, all of our real topics to Family Advisory Council so that we can get the voices directly from the families. And then I bring it back to the meetings to incorporate it in the work. With this SDOH tool, one of the most important things is patient and family privacy. So once the families answer these questionnaires, how are we protecting their privacy and ensuring that the information is secure and that it doesn't fall in the wrong hands where, it could be used against the family inappropriately. So we have to make sure that we have the secure safety measures in our medical record systems and Epic, so that when the families are answering the questions, it's not visible, and only pertaining to, who's capturing the information to provide the resources, and that it cannot be used in any other places. So,
Thank you for that. And I want to go back to something you said earlier about the range of resources that are needed. I think healthcare professionals do not understand how expensive healthcare is, and they do not understand how expensive a NICU admission or an antepartum plus a NICU admission or sets of twins actually cost. And I understand that even families that are quote unquote well off, this can dramatically change a financial situation.
Absolutely.
So for those people who are not kind of aware of, social determinants of health, where is the resource that you think is most lacking across the board, across the country? Where do we really have to be focusing our energy to support families?
So that is a really loaded question. I probably could talk to you about an hour just on my personal experience. One of the top of the list for our family that changed our financial picture very quickly, very dramatic, was assuming that because we had health insurance that everything would be covered. And that loaded question included, where do you live? So we had the babies in Philadelphia, Pennsylvania. We live in New Jersey. The laws are different. And so what that meant was we had no idea that we needed to have Medicare insurance as a secondary to truly ensure all of the
Necessities,
charges would be covered at just the NICU stay. And so after our discharge, we learned that we had a bill, hundreds of thousands of dollars, that was not covered by our health insurance. And then when we did apply for the Medicaid, we learned that in our state, the date of application is the date of your eligibility. Where we had the babies in Pennsylvania, the law is the date of injury, which would be the day that the children were born, is the date that the coverage would begin.
Wow.
So we were actually responsible for those bills.
Yeah.
So,
wow.
I'm very happy. Thank
you for sharing
Thank you
that.
for sharing
Yeah.
all that. And I'm very pleased to say that we already were chatting off air, and we're going to make sure that we can have Monica on the podcast in the upcoming season of the podcast, so that we can actually spend more than 10 minutes talking about this, because
We need a deeper dive here.
obviously. And if you guys are interested in the last point you made, this is something that we've addressed on the podcast many times before, thanks to Dr. Shetal Shah, where we have an advocacy series of episodes talking about the intricacies of Medicaid and coverage, and how this is impacting families, and how every state has different rules and regulations. And some things that, as neonatologists, we may sometimes think, oh, that doesn't apply to our patients, but in truth, it really does. So I suggest that you go check out the most recent episode, which was
this Sunday's episode.
last Sunday, episode 250, Keeping Baby Covered, Medicaid Matters, where we had Dr. Shah and Dr. Gleer on. But there are more episodes on the podcast about the churn and talking about eligibility dates. So if this is something you're interested in, we've taken it on. And Lord knows, as a Frenchman, it was difficult for me to prep for these episodes, because this is a very bizarre and complicated system.
I think we learned it's hard for everybody, even the people.
And can I share at CHOP how we utilize the family voice to I don't want to say combat, but really it's combat these issues with our Medicaid and all of the rules. We take our families to the Senate floor to advocate on all of these topics, and our families were instrumental in helping a bill called S3000 be passed to help ensure that all people, not just children, adults with Medicaid in New Jersey, can see who they need to see.
Wow.
Based on
That's
their
amazing.
needs.
And that's something that we've mentioned on the podcast. Dr. Shah and some of the people that came said the power of the story and how you want to effectuate change. We may not be all politicians. We may not be wanting to be politicians, but what Dr. Shah was mentioning over and over again is the fact that what we have that has the power to change the course of legislation is the stories. And we just need to go and share those stories, because they do have an impact. Thank you.
And a reminder then for everybody to go at least vote, right?
Yes.
That's
at the
the
very
very
least.
minimum.
Absolutely.
Please.
Monica, thank you so much for sharing your thoughts, and congratulations on this amazing work. And we'll see you very soon on the podcast.
Thank you.
Thank you.
Bye-bye.